Think your doctor always knows what's best? Think again. Every year, thousands of seniors undergo medical procedures that do more harm than good, yet most never question their doctor's recommendations. The medical system has a dirty secret. Procedures that boost hospital profits aren't always the ones that help patients, especially seniors. In 2012, the American Board of Internal Medicine launched the Choosing Wisely campaign after discovering that over 600 common medical tests and procedures were being overused or performed unnecessarily. The campaign revealed a shocking truth. Many procedures that seem helpful are actually dangerous for older adults, increasing their risk of complications, infections, and even death. In this video, we're exposing 5 medical procedures that doctors commonly push on seniors, but that you should seriously question first. Each one is backed by major medical organizations warning against overuse, yet many doctors continue ordering them out of habit, fear of lawsuits, or financial incentives. Stick around until the end, because procedure number 1 is performed on nearly 500,000 seniors annually, yet studies show it provides no benefit and often causes more suffering than comfort. But before we dive in, let us know in the comments. Have you ever questioned a medical procedure your doctor recommended? We're reading and replying to every single comment. Now let's start with a procedure that sounds helpful, but often backfires in seniors. Number 5. Antibiotic treatment for asymptomatic bacteriuria, UTIs without symptoms. This one might surprise you. Doctors are routinely prescribing antibiotics to seniors for urinary tract infections that aren't causing any symptoms, a condition called asymptomatic bacteriuria. But here's what they're not telling you. Treating these infections with antibiotics does absolutely no good and often causes serious harm. Asymptomatic bacteriuria simply means bacteria are present in the urine without causing symptoms like pain, burning, or fever. It's incredibly common in seniors, affecting up to 50% of women over 80 living in nursing facilities. But here's the crucial part. This bacteria isn't harming you, and treating it doesn't help. The Choosing Wisely campaign, backed by the American Geriatric Society, explicitly states, don't use antimicrobials to treat bacteriuria in older adults unless specific urinary tract symptoms are present. Why? Because multiple studies have found no adverse outcomes for older adults with asymptomatic bacteriuria. The bacteria are just there, harmlessly coexisting with your body. Yet doctors continue prescribing antibiotics based on positive urine cultures alone, without any symptoms. A 2019 study of UK hospitals found that seniors were being overtreated with antibiotics for asymptomatic bacteriuria at alarming rates. The researchers discovered that doctors were ordering urine tests unnecessarily and then treating positive results whether patients had symptoms or not. The consequences of this overtreatment are serious. Unnecessary antibiotics increase your risk of antibiotic-resistant infections, making future real infections harder to treat. They can cause dangerous C. difficile infections that kill thousands of seniors annually, and they disrupt your body's natural bacterial balance, sometimes leading to fungal infections and other complications. What's particularly concerning is that many seniors develop confusion, falls, or other problems and get labeled with a UTI when the real issue is something completely different. A recent study found that UTI was incorrectly diagnosed in up to 40% of hospitalized older people. If your doctor wants to prescribe antibiotics for a UTI, ask these questions. Do I have symptoms like burning, pain, or fever? If not, why are we treating bacteria that aren't causing problems? The Infectious Diseases Society of America is clear. Asymptomatic bacteriuria should not be treated in seniors because treatment provides no benefit and increases harm. The bottom line, bacteria in your urine without symptoms is normal aging, not a disease that needs aggressive treatment. Number 4. Routine cardiac catheterization for stable heart disease. Cardiac catheterization, where doctors thread a tube through your arteries to examine your heart, has become routine for many seniors with heart disease. But research shows that this invasive procedure is often unnecessary and can be dangerous for older adults. Here's the shocking truth. For seniors with stable coronary artery disease, cardiac catheterization offers no survival benefit over medical management with medications. A landmark study published in the New England Journal of Medicine found that patients with stable heart disease lived just as long, whether they had invasive procedures or took medications. Yet doctors continue pushing catheterization on seniors, often leading to unnecessary stent placements and surgeries. The risks for seniors are significant. Older adults face higher rates of complications from cardiac catheterization, including bleeding, kidney damage from contrast dye, and stroke. A study of patients over 75 found that complications increased dramatically with age, yet the benefits decreased. The procedure that might help a 55-year-old could harm a 75-year-old. What makes this particularly troubling is that many seniors undergo catheterization not because they have symptoms, but because of abnormal stress tests or doctor concerns about blockages. A qualitative study from Germany found that patients often accepted cardiac catheterization without questioning its necessity, driven by convenience and fear rather than medical need. The American College of Cardiology now acknowledges that routine catheterization in very elderly patients, over 75, requires careful screening to avoid situations that could lead to complications. Yet many seniors are still being referred for these procedures without adequate consideration of their age-related risks. If your doctor recommends cardiac catheterization, ask, do I have symptoms that aren't controlled by medications? What are the specific benefits for someone my age? What are the risks of complications? For many seniors with stable heart disease, optimal medical therapy with medications provides the same outcomes without the procedural risks. The key question isn't whether you have blockages, it's whether invasive treatment will actually improve your quality of life or longevity. For many seniors, the answer is no. Number 3, extensive cancer screening after age 75. Cancer screening that saves lives in younger adults can become harmful in seniors. Yet many doctors continue ordering mammograms, colonoscopies, and other screenings for patients in their 80s and 90s without considering life expectancy or treatment goals. The Choosing Wisely campaign warns against cancer screening in seniors when life expectancy is limited or treatment wouldn't be pursued. Here's why. Cancer screening is most beneficial when there's time for the cancer to develop and cause harm, and when treatment can extend life. For seniors with limited life expectancy, screening often finds slow-growing cancers that would never cause problems. The numbers are sobering. To prevent one death from prostate cancer, 1,055 men need to be screened, and 37 need to be treated over 11 years. For breast and colorectal cancer, 1,000 patients need to be screened to prevent one death over 10 years. But these statistics apply to younger, healthier populations. In frail seniors, the numbers are much worse. What makes screening particularly problematic for seniors is that positive results often lead to invasive procedures, biopsies, and treatments that reduce quality of life without extending it. A mammogram that finds a small, slow-growing breast cancer in an 85-year-old with dementia may lead to surgery and radiation that causes more suffering than the cancer ever would. Lung cancer screening provides another example. While screening 1,000 people might avoid 4 lung cancer deaths in 6 years, 273 people would have abnormal results requiring follow-up, 36 would need invasive procedures, and 8 would suffer complications. For frail seniors, these harms often outweigh benefits. The American Geriatric Society recommends stopping routine cancer screening when life expectancy is less than 10 years or when the patient wouldn't want treatment if cancer were found. Yet many seniors continue receiving annual mammograms, colonoscopies, and other screenings well into their 80s and 90s. Before agreeing to cancer screening, ask your doctor, what is my life expectancy? Would I want treatment if cancer were found? How likely is screening to find a cancer that would actually harm me? For many seniors, especially those with multiple health problems, the answer may be that screening causes more problems than it prevents. The goal should be comfort and quality of life, not finding diseases that treatment can't meaningfully address. But before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 2. Aggressive treatment of abnormal lab values without symptoms. Doctors love treating numbers, even when those numbers don't reflect actual disease in seniors. Laboratory abnormal results that would concern doctors and younger patients might be completely normal for your age, yet many seniors undergo unnecessary treatments based on lab values alone. We covered some of this in our recent video about blood test results that mean something different after 65, but it bears repeating. Normal ranges for many lab tests were established using data from young, healthy adults. Using these same ranges for seniors leads to massive overtreatment. Take hemoglobin levels. What doctors call anemia in a 75-year-old might actually be normal for that person's age. Yet seniors are routinely given iron supplements, expensive testing, and even blood transfusions based on hemoglobin numbers that wouldn't require intervention if age-appropriate standards were used. The same applies to cholesterol levels. Seniors are often prescribed high-dose statins to achieve cholesterol targets designed for 45-year-olds, despite evidence that these aggressive targets may not benefit and may even harm very elderly patients. Studies show that seniors with slightly higher cholesterol often live longer than those with aggressively lowered levels. Blood pressure provides another example. Seniors are frequently started on multiple blood pressure medications to achieve targets of 120/80 that might be dangerous for their age. Research shows that overly aggressive blood pressure lowering in seniors increases the risk of falls, fractures, and cognitive decline. The Choosing Wisely campaign emphasizes avoiding treatments based solely on lab abnormalities, without considering symptoms, age-appropriate ranges, and overall health status. Yet many seniors are taking multiple medications and undergoing procedures to treat abnormal numbers that don't represent disease. A 2018 study found that seniors were frequently started on medications or referred for procedures based on single abnormal lab values, without considering whether the values were appropriate for their age or whether treatment would provide benefit. The key is understanding that your lab values should be interpreted in the context of your age, symptoms, and overall health, not compared to a 30-year-old's numbers. If your doctor wants to treat an abnormal lab result, ask, is this abnormal for my age? Do I have symptoms? Will treatment improve how I feel or function? Many times, monitoring abnormal values is safer and more appropriate than aggressively treating them, especially when the abnormality reflects normal aging rather than disease. Number 1. Feeding tubes in advanced dementia. This is the most heartbreaking procedure that doctors push on families of seniors with advanced dementia. Feeding tubes, surgically placed tubes that deliver nutrition directly to the stomach, are presented as a way to provide comfort and prolong life. But the medical evidence is clear. Feeding tubes in advanced dementia provide no benefit and often cause more suffering. The American Geriatric Society position statement is unequivocal. When eating difficulties arise, feeding tubes are not recommended for older adults with advanced dementia. Yet approximately 30% of all feeding tubes are placed in patients with dementia, often against medical evidence and expert recommendations. Here's what families aren't told. Multiple studies show that feeding tubes don't extend life, prevent aspiration pneumonia, improve comfort, or enhance quality of life in patients with advanced dementia. A landmark study found that careful hand feeding is just as effective as tube feeding for outcomes, including death, aspiration pneumonia, functional status, and patient comfort. Instead, feeding tubes often make things worse. Research shows they're associated with increased agitation, greater use of physical and chemical restraints, more healthcare complications, and the development of new pressure ulcers. Patients with feeding tubes often have to be physically restrained to prevent them from pulling out the tubes. Hardly a dignified or comfortable end to life. The most comprehensive review of feeding tube research found no evidence that tubes improve any meaningful outcome in advanced dementia patients. Yet, they're inserted in approximately 216,000 Americans annually, often in seniors who can no longer make their own decisions about care. What drives this overuse? Financial incentives play a role. Hospitals and nursing facilities receive higher reimbursement for patients with feeding tubes. Medicare pays substantially more for patients with feeding tubes in the first 100 days of nursing home care. Facilities also worry about regulatory scrutiny if patients lose weight, making feeding tubes seem like protection against sanctions. But families often request feeding tubes because they haven't been educated about the natural dying process. When a person with advanced dementia stops eating, it's typically a sign that the body is shutting down naturally. Forcing nutrition through a tube doesn't reverse the underlying process, it just prolongs it. The most ethical approach, supported by medical evidence, is careful hand feeding for as long as the patient shows interest in food, along with excellent mouth care and comfort measures. This respects the natural dying process while maintaining human connection and dignity. If a doctor recommends a feeding tube for your loved one with advanced dementia, ask these critical questions. What evidence shows this will improve quality of life? Will it extend meaningful life or just prolong dying? What are the alternatives? The honest answer, based on medical literature, is that feeding tubes provide no benefit and often increase suffering. So there you have it, 5 medical procedures that doctors commonly push on seniors, but that you should seriously question first. From unnecessary antibiotics to feeding tubes that increase suffering, these procedures represent a medical system that often prioritizes intervention over appropriateness, especially for older adults. The common thread in all these procedures is that they sound helpful, but often do more harm than good in seniors. They reflect a medical culture that struggles to acknowledge that aging bodies don't always respond to treatments the same way younger bodies do, and that sometimes the best medicine is no medicine at all. Remember, questioning your doctor doesn't make you difficult. It makes you a smart healthcare consumer. The Choosing Wisely campaign exists because medical professionals themselves recognize that overtreatment is a serious problem. You have every right to ask about the benefits, risks, and alternatives to any procedure, especially as you age. Your body is not the same as a 40-year-old's body, and your medical care shouldn't be either. Age-appropriate medicine means understanding when intervention helps and when it hurts, when aggressive treatment makes sense, and when comfort care is wiser. Which of these procedures surprised you most? Have you ever questioned a doctor's recommendation and discovered it wasn't necessary? Share your experiences in the comments. We're reading and replying to every single one. And if you want more senior-focused health information that challenges medical overtreatment with real science, make sure to subscribe and turn on notifications. Your health decisions deserve better than reflexive medical interventions designed for younger patients. Remember, the goal isn't to avoid all medical care. It's to receive care that's appropriate for your age, health status, and goals. Sometimes the most caring thing a doctor can do is recommend against a procedure, and the most empowered thing you can do is ask the hard questions first. Thanks for watching, and here's to smarter, more appropriate healthcare after 65.